My name is Jessie and I work in Indina's ICU, and I'm going to talk about the types of bands we're going to be using for our radial diagnostic heart cath and the PCIs. The radial approach is safer for our patient and it is less painful for them as well. There's less than 1% chance of a brain bleed, less than 1% chance of a hematoma, and less than 10% chance of a GI bleed. In a femoral approach, you have more of a chance of a retroperitoneal bleed and other types of bleeds and complications. You're going to want to, if it's a diagnostic only, start removing air 30 minutes after they've had the intervention done, and if it's an intervention, 1 hour after they've arrived to the floor. Signs and symptoms that you'll want to look for is similar to a radial A-line. You're going to look for their capillary refill, sensation, pulses, color, coolness. They may have in their second and third fingers tingling or decreased sensation. They may have a little bit of pain. There are two types of bands that you'll see here at Indina. One you guys are more familiar with. It's the TR band. I'm going to use my assistant here. The physician will already have this on, and their site will already be closed and have air in it. You're going to want to pull 2 cc's of air out every time with the TR band for every 15 minutes. The main thing with it, you're going to hold on to the plunger here when you pull back, because you don't want it to pull more air than 2 cc's. If you notice any signs of leaking at the site, you'll just want to reinsert the 2 cc's that you put in. If the patient is complaining of a hematoma, if you feel like there's a raised area or anything, you can hold manual pressure at the site or apply a second band. There's a new band that you will start seeing that actually is quite nice. It has a lock system, so you cannot remove more than the 2 cc's of air. So you'll want to make sure that it is to the lock site. You'll pull back, or you'll insert, and it's a lure lock system, so you cannot, it's not going to pull out, and it'll just pull back the 2 cc's of air automatically on its own. If you have it off the lock site, it will pull back more, so you just want to make sure that it is locked over here. Upon discharge, what you're going to want to teach the patient is not to lift more than 2 pounds for the first 24 hours with the arm that was used for the intervention, and then not more than 5 pounds or a gallon of milk for 48 hours. While they are in the hospital, you're going to want to make sure that they keep their arm below the level of the heart. You're going to want to just make sure they don't use that arm. They can eat with their left arm, they can still get up, or if they use the other arm, vice versa, they can go to the bathroom. It should be much better for our patient, safer. If you have any questions, you're more than welcome to talk with Kennetha. She is the ICU 2 North 2nd floor educator, as well as any of the cath lab staff, or myself, or Wendy. And then afterwards, if you could just fill out this little monkey survey for us, that would be great.